According to an article from University of Minnesota, states that by the year 2030, minorities are expected to be overrepresented in nursing homes. In fact, from 1998 to 2008, Hispanic and Asian individuals living in nursing homes increased more than 50%, and African American people living in nursing homes increased by 10%. The number of elderly in long-term care facilities is projected to grow dramatically. In fact, the U.S. Department of Health estimates that 70% of Americans over the age of 65 will require long-term care at some point. Furthermore, despite the increased use of nursing homes by minority residents, nursing home care remains highly segregated. A research article from Health Affairs explains that compared to whites, racial or ethnic minorities tend to be cared for in facilities with limited clinical and financial resources, low nurse staffing, and high care deficiencies. LGBT individuals experience health disparities throughout their lives, and health issues in anyone's younger years may lead to the need for long-term care later on in life. An article from longtermcare.gov explains that health disparities can have a major impact on some LGBT individuals, such as LGBT adults are less likely to have health insurance coverage, face barriers to access as older adults due to isolation and a lack of culturally competent providers. A study suggests that 13% of older LGBT adults were denied or provided inferior health care, and 22% of LGBT older adults do not review their sexual orientation to physicians. Another study indicates that elderly LGBT adults face distress from potentially hostile staff and fellow residents. They also face denial of visits from partners and family of choice, as well as refusal to allow same-sex partners to room together. Many Americans over the age of 65 will need long-term care at some point. However, affordability and quality of care are important factors to choose their long-term care facilities. According to a new AARP, the SCAN Foundation and the Commonwealth Fund suggest that best long-term care services and supports are in Minnesota, Washington, Oregon, Colorado, Alaska, Hawaii, Vermont, and Wisconsin. On the other hand, the worst states are Kentucky, Alabama, Mississippi, Tennessee, and Indiana. When it comes to affordability and access, the worst is Kentucky and the best is Washington, D.C. When it comes to choice of setting and provider, the worst goes to Alabama and the best goes to Minnesota. When it comes to quality of life and quality of care, Oklahoma is the worst and Minnesota is the best. When it comes to support for family caregivers, Indiana is the worst and Hawaii is the best. When it comes to effective transitions, Louisiana is the worst and Oregon is the best.
In this section, we'll be talking about the abuse and neglect seniors might experience in long-term care. Based on statistics, over 1 in 6 nursing home residents may have been a victim of abuse or neglect every year. 3/4 of these neglect or abuse cases in nursing home are perpetrated by caregivers. More than 44% of nursing home residents have reported that they have been abused in some way during the time of their residency. From the same survey, 95% of senior residents have seen other residents neglected. Seniors who have been abused have a 300% greater chance of death in the 3 years following the abuse than those who aren't abused. There are many forms of abuse which can involve physical abuse is any condition that could cause physical harm such as hitting, slapping, pinching, and etc. Neglect can also be a form of physical abuse because they use too much force when restraining a senior or lack of physical care. Physical abuse is anything that can cause unwanted sexual attention or exploitation. Psychological abuse covered a wide range of aggressive behaviors that could affect a resident's psychological well-being and causes a change of behaviors. These aggressive behaviors include screaming, yelling, humiliating, and criticizing senior citizens. Financial exploitation is when caregivers have taken advantage of the senior residents' financial matters through stealing or manipulating. Using resident personal information to apply for credit card would be an example of financial exploitation. Most of the time, neglecting of residents are done unintentionally and often due to the shortage of staffs. Not providing adequate care for personal hygiene, food, water, and medical care is a form of neglection. All of these abuses and neglects can be done by caregivers to residents and resident to resident. These are the signs and symptoms of abuse and neglect: broken bones or fractures, bruisings, cuts or welts, bed sores, frequent infections, signs of dehydration, mood swing and emotional outbursts, reclusive or refusal to speak, refusal to eat or take medication, unexplained weight loss, poor physical appearance or lack of cleanliness, changes in mental status, caregivers that do not want patient to be left alone with others. All of these signs and symptoms does not always result from neglect or abuse, but caregivers or families should be aware when seniors show these signs and symptoms. Since we have talked about the different type of long-term care for different social-economic class in the United States, today we'll be exploring different countries with the best long-term care. Here are the 10 countries with the best long-term care based on U.S. News. Switzerland placed first in the country with the best long-term care. Next is Norway. Sweden is third. Germany is fourth. Canada is fifth. Netherlands is sixth. Iceland is 7. Japan is 8. United States is 9. And United Kingdom is 10th. The reason why Switzerland placed first because this country have one of the best healthcare system in the world. This is due to the fact that 99.5% of Swiss citizens have full coverage health insurance. Citizens can choose from 100 different private insurance companies. This increased the competition between insurance companies with pricing and coverage, which can prevent healthcare inflation in the country. The insurers can choose their doctor and appointment waiting time. Their great healthcare system reflects on Swiss citizen health expectancy, which is an average of 82 years old, the ninth highest in the world ranking.